Hey everyone, and welcome back to Study Nurse IQ. I'm Ginny, and today we're diving into a super important topic: oxygen delivery devices and key respiratory concepts like hypoxia and sleep apnea. This is essential knowledge for your nursing classes and the NCLEX. So let's jump right in. As nurses, we need to know the right tool for the job. Here's a breakdown of common oxygen delivery devices, from low flow to high flow. Nasal cannula, a simple, comfortable device that sits in the patient's nostrils. Flow rate 1 to 6 minim. Nursing tip: if the flow rate is above 4 liters per minute, the air can be very drying. Use a humidifier and a water-based lubricant to keep the patient's nasal passages moist and comfortable. Simple face mask, a mask that covers the nose and mouth. Flow rate 6 to 10 minim. Consideration: this makes it difficult for patients to eat, drink, or talk, so you'll need to remove it for meals. Partial rebreather and non-rebreather masks. These masks come with a reservoir bag attached that collects oxygen. Here's the most important rule: always make sure that bag is inflated at least 2/3 full before placing it on the patient. If the bag deflates, the patient could suffocate. So you'll need to adjust the flow rate to keep the bag properly inflated. Now, what's the difference between the two? Partial rebreather mask. The patient breathes in oxygen from the bag, but also rebreathes some of their exhaled air. Flow rate is usually 10 to 12 liters per minute. Non-rebreather mask. This one has a one-way valve that prevents the patient from rebreathing exhaled air. That means it delivers the highest concentration of oxygen you can give without intubation. Flow rate is typically 10 to 15 liters per minute. Venturi mask. This is a special mask that provides the most precise oxygen delivery without intubation. It works by mixing specific amount of oxygen with room air using color-coded adapters for accuracy. The flow rate usually ranges from 2 to 15 liters per min. It varies based on the setting. Fun fact: it's often used for patients with COPD who need precise, controlled oxygen delivery. Finally, we have a face tent, a cone-shaped mask that rests over the patient's face. Flow rate high, usually over 15 milliliter. Use: this device is great for patients with facial trauma or burns who can't tolerate a regular mask. It also provides high humidification. All right, so now that we've gone through the different oxygen delivery devices and how much oxygen they provide, let's connect this to why we use them in the first place. As nurses, it's not just about knowing the equipment, it's about recognizing when a patient needs oxygen therapy. And that brings us to three key concepts you'll hear all the time: hypoxemia, hypoxia, and oxygen toxicity. Let's break them down. Hypoxemia: insufficient oxygen in the arterial blood. It's diagnosed by an ABG, arterial blood gas, with a PaO2 less than 80 mmHg. Hypoxia: insufficient oxygen in the body tissues. Hypoxemia can lead to hypoxia. It's crucial to know the signs of hypoxia. Early signs are restlessness and irritability, tachycardia and tachypnea, hypertension, pallor, accessory muscle use, nasal flaring. Late signs of hypoxia are decreased level of consciousness, bradycardia and bradypnea. Cyanosis: always use the lowest flow rate needed to correct a patient's hypoxemia. Giving too much oxygen can lead to oxygen toxicity, a dangerous condition that can damage the lungs. Symptoms of oxygen toxicity: non-productive cough, substernal chest pain, nasal congestion, sore throat. Now let's talk about a common respiratory disorder: sleep apnea. Definition: a breathing disruption during sleep that lasts at least 10 seconds and occurs 5 or more times per hour. Types: obstructive sleep apnea, OSA, the most common type. The airway becomes physically blocked by relaxed muscles, the tongue, or the soft palate. Central sleep apnea: the brain fails to send the proper signals to the breathing muscles. Risk factors: sleep apnea, obesity, large tonsils, and certain neuromuscular disorders. Signs and symptoms: persistent daytime sleepiness, irritability, and loud snoring. Diagnosis and treatment: sleep apnea is diagnosed with a sleep study. Treatment often involves a CPAP, continuous positive airway pressure, or a BiPAP, bilevel positive airway pressure machine, to keep the airway open. In some cases, a tonsillectomy may be needed. Let's test your knowledge with a few NCLEX-style questions. Question 1. A nurse is caring for a patient receiving oxygen via nasal cannula at 5 liter per minute. The patient reports nasal dryness and discomfort. What is the most appropriate nursing action? A. Switch the patient to a simple face mask. B. Decrease the oxygen flow rate to 2 L-min/. Attach a humidifier to the oxygen delivery system. Instruct the patient to breathe through their mouth. Answer C. Attach a humidifier to the oxygen delivery system. Rationale. Oxygen flow rates above 40 liters per minute via nasal cannula can cause nasal dryness. Attaching a humidifier adds moisture to the air, which helps alleviate the patient's discomfort without changing the prescribed flow rate. Question 2. The nurse is assessing a patient with a respiratory condition. Which of the following findings would be considered a late sign of hypoxia? Restlessness, tachycardia, nasal flaring, bradycardia. Answer D. Bradycardia. Rationale. Bradycardia, a slow heart rate, is a late sign of hypoxia, indicating that the body's compensatory mechanisms are failing. Early signs of hypoxia include restlessness, tachycardia, and nasal flaring, as the body attempts to increase oxygen intake. Question 3. A patient is diagnosed with obstructive sleep apnea. The nurse explains that the primary cause of this condition is A. The brain failing to send proper signals to the breathing muscles. B. The tongue or soft palate blocking the upper airway during sleep. C. Insufficient oxygen levels in the arterial blood. D. Damage to the alveoli from smoking. Answer B. The tongue or soft palate blocking the upper airway during sleep. Rationale. Obstructive sleep apnea is caused by a physical blockage of the upper airway, most often due to the tongue or soft palate relaxing and collapsing. Central sleep apnea is caused by the brain failing to send signals to the breathing muscles. I hope this video has been helpful. Remember to like, comment, and subscribe for more nursing content. Thanks for watching Study Nurse IQ. Nursing Made Simple.